This is International Council of Nurses, and this item is 5.0, Tuberculosis Action Plan for the WHO European Region 2016-2020. Tuberculosis negatively impacts global social and economic development by disproportionately affecting poor and marginalized communities and those in the productive age group. Efforts are needed to reach underserved populations and to reduce stigma and discrimination. Multi-drug resistant TB, MDR-TB, accounts for 1/3 of all antimicrobial resistance, AMR, related deaths globally. As such, continued efforts are required on the AMR agenda as it is central to tackling MDR-TB. Priority must be given to strengthening European health systems, focusing on countries with the highest burden of disease. We call on European countries to invest in nurses to ensure an adequate number of well-educated healthcare professionals for TB prevention, treatment, and delivery of quality person-centered care as part of integrated health services in line with universal health coverage targets. Efforts must be increased to end tuberculosis and tuberculosis transmission through improved infection prevention and control measures, IPC. This will require funding and high-level support in countries to ensure that IPC is prioritized and funded. Healthcare professionals are at high risk of tuberculosis and multi-drug resistant tuberculosis. Therefore, International Council of Nurses urges to increase focus on occupational health to protect our health workforce. Nurses are the largest clinical providers of TB care worldwide. In this regard, ICN urged the WHO Regional Committee for Europe to develop and introduce legislation, regulation, and policy that support optimal use of the nursing workforce in its delivery of tuberculosis programs. International Council of Nurses works to engage nurses in strengthening health systems and to be strong advocates to end tuberculosis. We strongly commit to work with our members to position nurses as role models for tuberculosis care, to reduce stigma and discrimination.